As you all are aware that we're focusing a lot on testicular cancer. So what happened after the surgery is done, and actually what will happen to a man who has got an empty scrotal sac? Essentially, the operations that carries out in order to get rid of the cancerous testicle is called radical orchidectomy. So clearly, when one is removed, it's left with an empty sac. And that itself sometimes might actually lower the self-esteem for an individual who suffers from testicular cancer. In fact, it's not just someone who actually loses a testicle that way. For example, a twisted testicle is a condition called testicular torsion, or sometimes trauma or an infection called epidermolysis might end up leaving somebody with only one testicle left. In fact, the testicle on the other side, which is not affected, can be totally functional. The two functions, number one, continue to produce sperms, and number two, continue to produce the hormone that is required, namely the testosterone. So for an individual who are contemplating a prosthesis, which is a fake testicle to put into the scrotum, actually has no physiological impact and no functional impact at all, because it won't produce sperm and it will not produce any hormone. It's purely for the actual self-esteem and also for cosmetic reasons. So actually, the history of putting prostheses in the testicle has dated back for at least 100 years. In the old days, sometimes people put in glass or put in ivory in order to simulate a testicle on the other side. But in the 1990s, then during the time of mammary or breast prostheses, silicone was also used. But after the scarce of silicone, the newer version of silicone or even saline-filled implants has been used in order to do that. In order to identify what or how to put it in, one needs to know what is the size of the other normal testicle. For example, the normal size, which is an M size, it should be about 4 centimeters. For some individual with a smaller size testicle, for example 2 to 3 centimeters, then one can use an orchidometer in order to identify smaller testicle, and a big size such as more than 5 centimeters can be used for a large or extra large size. Once the size is identified, the patient can choose the shape that they want, and then that is put in a sterile method, either put through the scrotum or put through the inguinal area in order to create a symmetry for the testicle. After the procedure, most men are quite happy with it because it creates some sort of symmetry and gives them self-esteem. However, some people regret putting in, especially there's 1 to 3% of complication rate, such as infection or hematoma, which is collection of blood. To wrap up the month of November, we want to use a test case of an individual or a famous individual who underwent the journey of testicular cancer. And we're going to focus on Lance Armstrong. Stay tuned for next week's Putting Dr. G on the Spot.